Hello students, Rajvinder here with new topic that is belongs to disorders of cardiovascular systems, and the topic is coarctation of aorta. Coarctation of aorta is a discrete narrowing of aortic arch, usually in juxtaductal position. Where is this position? In the region of ductus arteriosus and left subclavian artery, near the ductus arteriosus and left subclavian artery. And here it is clearly written, there is a localized narrowing of the aortic arch just distal or proximal to the ductus of ligamentum arteriosus. Ligamentum arteriosus, also known as patent ductus arteriosus. And what does the meaning of distal? Distal is uh, something situated away from the center, and proximal is something is situated nearer to the center. I hope you understand. Then the next is causes, ductus tissue theory or hemodynamic theory. Then epidemiology, 6 to 8% of people belongs to infancy or belong to kids group suffering from this disorder. Female suffering more as comparative to male. Then the next is association. The coarctation of aorta belongs when the coarctation of aorta occur, then it associated with various symptoms like Turner syndromes. Turner syndromes, actually it is a chromosomal disorders that affects only females, and it involve a lack of part or all of a second sex chromosome in some or all cells, and the female suffering from this usually have shorter stature. Then bicuspid aorta valve, 30 to 40%. Bicuspid aorta valve mean usually aortic valve, three aortic valve are present in the heart, but in this condition only two leaflets instead of three in the aortic arch. Then PDA, patent ductus arteriosus. Then aortic stenosis. Aortic stenosis means when heart aortic valve narrow. And mitral stenosis. Mitral stenosis means when mitral valve narrow. Then intracerebral association are also there. Next is embryology. What happened during the time of development of fetus. Then at the time of 6th to 8th week of gestation, 4th and 6th aortic arch developed. The 4th arch connect dorsal to ventral aorta and form aortic arch at the time of 6th to 8th week of gestation, and the 6th arch develop distally to DA. Then next is types of coarctation of aorta. First one is preductal, and second one is postductal. What do you mean by preductal? Preductal means there is constriction of aorta between left subclavian artery and ductus arteriosus, and the postductal is there is constriction at or distal to ductus arteriosus. Then next is coarctation of aorta, diagram with coarctation of aorta and with normal heart. Then development of patterns. If we talk about the coarctation of aorta, if we said that it's a simple one, when only coarctation of aorta present at the exact position where we studied. Then the next one, when the coarctation aorta present along with patent ductus arteriosus, it is also known as complex one. And the pathophysiology of coarctation of aorta is, in coarctation there is a narrowing which can be either discrete or involve a long segment and can vary in severity from a mild constriction to total occlusion. This impedes blood flow to the lower portion of the body, creating increased pressure proximal to the obstruction. So there is increased pressure in upper part of the body and lower pressure in lower part of the body. Then the growth of the lower part of the body less as compared to the upper part of the body, because the upper part of the body have sufficient blood supply as comparative to the lower part of the body. Then genetic disorder, it run in the families. Then the next is, in early days this disorder is a acyanotic, means no blue coloration is there, discoloration. Then perfusion of lower body depends upon right ventricle output. Then here the right ventricle put blood into the pulmonary artery and pulmonary artery give blood to the right atrium, then right ventricle, then it give blood to the aorta. And blood, the aorta supply the blood into the upper portion but decreased supply in the lower portion. Right to left shunting are there. Upper extremities pink and lower blue, because on the upper part of the body there is a good supply of blood as comparative to the lower part. Then severe pulmonary hypertension, because aorta push the blood back into the pulmonary artery. Then left ventricular hypertrophy, because when the pulmonary artery overloaded, then it regurgitate and backflow into the when the aorta do not send exact supply to the systemic circulation, then it regurgitate and backflow into the left ventricle. That's why left ventricle become enlarged in size due to more blood collected in the left ventricle. Then it causes heart failure. After that, cardinal feature. In cardinal feature, hypertension in the upper body, because there is a more blood supply as compared to the lower portion. Then palpable collaterals. After that, thrill and heave. Then uh, the child suffering from the coarctation of aorta, high blood pressure before point of coarctation on the upper extremities, there is a high blood pressure as compared to the lower one. Low blood pressure beyond point of coarctation, then coarctation of the aorta. Then the next one is clinical features. In clinical features, we have to check the pulses, blood pressure and heart murmur. Murmur is a abnormal sound which we heard with the help of stethoscope. Then in infant, depends on patency of patent ductus arteriosus. Then shock and heart failure, metabolic disturbances, hypothermia, hypoglycemia, hypoperfusion and renal failure. After that, in case of child, upper extremity hypertension and lower extremities hypertension, widened pulse pressure, variability in right and left arm pressures, not equal, murmurs, abnormal sounds. Then there are some grades. In the first grade, there is a very less sound we heard, that is abnormal, very less abnormal sound we heard, and in grade 2 we heard audible but is immediately audible, uh, but it's a faint sound. In the third grade, refer to murmur that is moderately loud, and in grade 4 the murmur that is very loud. In the grade 5th it is more loud than in the grade 6. Murmur is so loud that is audible with the stethoscope just removed from contact with the chest wall. In general, murmurs with an intensity of grade 4 or higher are accompanied by a palpable thrill. Then others clinical symptoms: intermittent claudication due to a temporary inadequate supply of oxygen to the muscles of the leg. Then pain and weakness of legs and dyspnea on running. After that, investigations in antenatal period, fetal echo 16 to 18 weeks of gestation, helpful to identify long segment, small left ventricle, dilated right ventricle and flow through ductus, difficult to detect coarctation. Okay, in x-rays, cardiomegaly we can see, then rib notching. The next one is echo, high peristernal, suprasternal, long axis, shelf within lumen of thoracic arch. These kind of things we can find out with the help of echocardiogram. Then ECG, MRI, barium swallow, cardiac catheterization are also prescribed by the doctor. Then in management, in medical management, initial stabilization, inotropic drugs, prostaglandin 0.01 mcg per kg. Then surgical repair, end-to-end anastomosis means the narrowing part remove and the normal part joined with each other. Then left subclavian flap, ligate left subclavian artery and close subclavian artery flap over the coarctation of aorta and suture in place. After that, prosthetic patch aortoplasty, longitudinal incision made across coarctation of aorta and area enlarged with patch. After that, bypass graft, a tube is swung between ascending and descending aorta, and balloon angioplasty also prescribed in this. After that, stent implantation also there to remove the narrowness of the arch. Then complication, there are also complication. Residual coarctation of aorta means some percentage of coarctation of aorta is also left after the treatment. Recurrent coarctation of aorta, it occurs again. Systemic arterial hypertension, coronary artery disease, progressive valve disease, bicuspid stenosis, bicuspid regurgitation, aortic aneurysm and back endocarditis. Means these kind of complications are also there. I hope you understand this topic. If you feel any kind of problem to understand this, kindly convey me. I feel very happy to help you. Thank you very much.